My name is Joe Price. I'm from Pico Rivera, and I'm a certified emergency medical technician. And like Alex, I was a volunteer all 8 days providing health care at the fort. And what I come down here to show you is that access to health care shouldn't be having to wait 12 hours to get a wristband in order for you to get another line at 4 in the morning, and then when you pass medical screening, you get this magic medical lotto ticket. This is an authentic ticket from the event, and I put it in this lotto sleeve that says, "Who's next?" to be kind of ironic about it. Because healthcare is a right. It shouldn't be a matter of winning the lotto. And that's a statement that I want to make.
Thank you. Thank you very much.
So I'm going to get to this because the public option is the problem, because that's a name that goes out there. I think too many people of the public think that anyone can get this public plan, when in reality the CBO says it's maybe 10 million people. So I want to know, and I want to get you back. You say I'll go in the fire with you. I want to get you back to the HR 676, and we need to get back there. And if we can't get that passed, then we can start organizing against the people who are going to prevent that from passing. But let's be specific here. How is this public option that's only going to ensure 10 million people ever going to control costs? Especially when there's a mandate. I have no mandate if I'm allowed the opportunity to go on to buy into Medicare, but I'm not being provided that option in any of the bills that have been passed right now, let alone what's being discussed in the Senate. So that's my question. How's the public option going to control costs? If
There are several things that we talked about. As you know, one of the problems that we had that we just haven't talked about a lot is the fact that John Conyers has a single payout, and that they won't even let it up to be heard. It has been kind of nasty behind the scenes. We're trying to get to single payer, and basically we just were not able to keep even some of our more progressive people in line because of all of the pressures that they were receiving from, I'll just say in general, leadership. And so that's why
you can be specific with our
we were going to draw a line in the sand and we weren't going to move anymore on public option. If we do this, it's got to be paid for. It has to be paid for. The president has said he's not going to sign any bill that would create a deficit. The way that they've talked about paying for it, several different ways. We didn't talk a lot about the technology. We didn't talk about the technology. That is supposed to increase savings. I was in all of these healthcare clinics over the past few weeks, and I was kind of surprised that they still have rooms full of folders with all of the cases in them, and we know that that is not cost effective. So we're talking about creating a bunch of savings there. We are talking about some changes and ways of doing things better in Medicare. We are talking about putting a tax on the richest people in America. So many tax cuts under Bush. They had 3 sets of tax cuts. And I think that's a legitimate source of money. And we have got to put together all of the different ways by which we raise the money to cover everybody. I know what has been said, but we can't say we have comprehensive universal health care unless it covers everybody. I'm getting into that. One at a time, right here.
He asked a great question. I would like to know how only 10 million people, which I didn't know, are covered by the public option, how that would compete or reduce costs. Excellent question.
CBO says only 10 million people in the most ambitious of all the bills of TRICARE that came out of the House of Energy would only cover 10 million people. Now 10 million people, I mean, when you talk, and that's why I'm looking for the staff report, 10 million people on top of having to negotiate fees with doctors, a network that's not, you're not allowing the public option to be on a requirement of any doctor that takes Medicare. These are the specifics that I've been looking at from a progressive, looking at this bill from the left. And if I was allowed to buy into Medicare, if I'm not getting single payer, at least allow people to buy into Medicare. Make all federal government employees part of that public option. But mandating me to buy private insurance, which is what the majority of Americans will have to do, that's just junk insurance. They're just going to pay a high level, a high cost for anything that they can get away with, and they'll be, the minute this legislation is passed, they'll start picking away with it, with their 6 per Congresswoman. So we're going to
Well, first of all, let's kind of talk about the mandate. It sounds strange to talk about mandating people to purchase their own health care, but after paying special attention to this, it really did become very clear for me, and that's this. If you are in a car accident and you go to the emergency room and you have no health care, the other citizens are paying for you. That's true of all of the health care that you would receive when you need it, whether it's at a public health clinic, if you have no money, or whether or not you're in an emergency car accident, or other kinds of things. So it became clear to me that it is fair to say that if you did not get your own health care, we're giving you a public option. We're giving you, just a minute, we're giving you a public option so that you don't have to get your health care from any of those private insurers. Our responsibility is to make sure that we have enough money to cover everybody. We can't put out a bill that says that we're going to have universal health care unless it is paid for. Catherine, you have something to add to that? Please go ahead. We got a microphone.
Tell us how it's going to reduce costs.
Hold on. Yes.
Can y'all hear me?
Yeah.
Thank you. CBO estimated the number of people they thought would choose the public option. They expect a lot of people will continue to have their current policy. There are a lot of people saying they like what they have.
47 million of nothing.
Well, we want to fix that. We want to make sure that they have a range of choices, and the exchange will give them a range of choices. The public option will be one of the choices. I think there are going to be a lot more than 10 million people who will choose the public option.
Thank you. Thank you, Catherine.
Okay, next.